This episode of NANcast is sponsored by the American Academy of Pediatrics and RQI Partners. The 9th edition of the Neonatal Resuscitation Program brings science changes and delivers new resources and coursework updates from the textbook of Neonatal Resuscitation to the complementary Science and Service course, empowering providers to deliver expert care at every birth. Learn more at aap.org/NRP. Hello, and welcome to NANcast. I'm Jill, your host. Have you ever been in a neonatal resuscitation and realized the situation required skills or considerations that went beyond standard NRP training? In today's episode, we're talking about how the NRP program is expanding to support those moments. From supporting pre-hospital professionals responding to newborn emergencies outside of the hospital, to guiding teams caring for newborns with congenital heart disease, to responding to an emergency outside the hospital setting, or resuscitating a preterm or critically ill infant in the NICU. In this episode, we'll look at why NRP is extending its reach, what's included in the newest training offerings, and how these updates can help clinicians adapt the NRP algorithm and tailor their approach when caring for newborns in complex or non-traditional settings. Joining me are three leaders in neonatal resuscitation: Dr. Taylor Sawyer, Dr. Beth Ann Johnson, and Dr. Chris Cooper. Dr. Taylor Sawyer, a member of the AHA Education Writing Group, a member of the ILCOR Task Force, and co-lead of the new NRP module, which focuses on resuscitation in the NICU. Next, Dr. Beth Ann Johnson, bringing her expertise in neonatal resuscitation and procedural competency as the co-director of education and simulation training in the Perinatal Institute at Cincinnati Children's Hospital and medical director of simulation in the Cincinnati Children's Hospital. And finally, Dr. Chris Cooper, a nurse practitioner serving as NRP nurse consultant, co-editor for the AAP, and member of the NRP Steering Committee, as well as the NRP Instructor Development Working Group. Together, they will walk us through these important changes and what they mean for neonatal nurses and advanced practice providers. Let's get right into it. Thank you all for joining us today. I think that anybody that's worked in a NICU has felt that moment of, okay, this isn't standard NRP scenario anymore. And it seems that the new direction of NRP steps in to fill that gap. Why is it important for NRP to extend its reach beyond the delivery room? And what kind of needs did you see that led to developing these new courses?
Yeah, I can cover the reason behind extending NRP outside the delivery room into the NICU. It's a common question that comes up, and it seems like it's being asked more and more frequently. I think the question that NRP receives is, what's the time that you would change from using NRP to PALS? And for those of us who teach both NRP and PALS, there's clear differences between the two courses. And I'll just say that, the current PALS curriculum is definitely not geared towards the NICU. So while PALS is one option, there was maybe an easier way to sort of meet in the middle, just to augment what's available in NRP, but then to adapt it and build onto it to create a new educational module and a hands-on course that's more specific to the patients that we encounter in the NICU.
And I'll maybe add on to that to speak to kind of what led us to create some special chapters, information modules on resuscitating babies with congenital heart disease. Because just like Taylor's talking about augmenting NRP, that's kind of what we were trying to do for babies with heart disease. Like gold standard NRP teaching and algorithms are still what we really believe in, but there are some newborns with some specific anatomic lesions, cardiac lesions, that their physiology, their transition in the delivery room creates a scenario that their targets for that NRP algorithm are going to have to be a little bit different. So for structural lesions where the blood mixes, the red blood and the blue blood, like they are less likely to be able to meet those goal sats at the 10-minute point of the 85 to 95%. So in the modules, we go into what lesions are most likely to have an adjustment to that target saturation. And similarly, we talk about rhythm disturbances, that there's a module on both really slow rhythms and fast rhythms, and why those rhythm abnormalities are you're going to have to adjust what your heart rate goals are as you navigate through the algorithm. So much of the gold standard algorithm is hinged on what the heart rate is throughout. And so for babies with arrhythmias, dysrhythmias, either fast or slow, you kind of have to adjust what your expectations are as you go through the algorithm. So we were looking to create some hopefully easy to understand on some really complicated and complex situations to really help people in the delivery room and soon after delivery to adjust those expectations, to know which babies they should be really concerned about, to anticipate babies that are likely to really struggle, and then to help people prepare to hopefully successfully lead that resuscitation.
That makes a lot of sense. Resuscitation is a continuum, right? It just doesn't happen in the DR, but it goes beyond that. And I think it's great to see NRP acknowledging that what teams experience in real life. Like, we all have the resuscitation experiences in the NICU where you're sort of, is this PALS? Is this NRP, like Taylor mentioned? And, we all struggle. And I think there's a lot of fear and uncertainty around resuscitation of a cardiac patient because they do deviate. So what you're saying is, in the new 9th edition, there will be 2 new chapters, one focusing on NICU resuscitation and then one focusing on cardiac. So what are those modules? What are they going to look like for someone that's going to be taking those?
So for the cardiac modules, for the NRP cardiac, the supplemental learning, there are online modules that folks can register and take. There are actually 8 modules and an introduction. The first module talks about the transition physiology and what happens from a cardiorespiratory perspective, how it's supposed to happen, and then how the structural heart disease can impact how that transition happens. There are then 4 modules on specific heart lesions, hypoplastic left heart syndrome, tetralogy of Fallot, transposition, and Epstein anomaly. And then there are 2 modules on rhythm abnormalities. So as I was mentioning earlier, there's a module for fast heart rates, and there's a module for slow heart rate. And then there's a final module for when to think about heart disease in a baby that it hasn't been prenatally diagnosed, but that the baby isn't responding to NRP in the delivery room like you would expect. So there's that final module that talks about the undiagnosed, or the heart disease that's not diagnosed prenatally, and how you might shift and adjust your resuscitation for that situation.
Beth Ann, you had mentioned about the cardiac defects when it's unknown, and we all know that that's a challenge in the delivery room. So how might the standard NRP algorithm need to be modified for those infants that have cardiac anomalies, or the cyanotic heart defects, and your arrhythmias, and even those surprise? I think that this baby may have a cardiac defect when you're trying to resuscitate and they're not responding to standard NRP.
Sure. So how the NRP algorithm might need to be adapted for babies with congenital heart disease is in those targets for heart rate and oxygenation that I had briefly mentioned earlier. The other important thing that these heart modules provide is they provide an outline to help people think about, how do you even approach attending this delivery of a baby that is prenatally diagnosed to have heart disease. We all know that there are really important pre-brief questions for every delivery that NRP provides, but in these cardiac modules, we provide a list of additional pre-brief questions to really help facilitate not gathering information and preparing for a baby with congenital heart disease. So we ask questions like, what is the heart disease? What are the associated factors? Do we expect this baby to be stable or unstable in the delivery room? And speaking to the algorithm, do we have to adjust what our heart rate goals are? Do we need to adjust what our oxygen saturation goals are? Do we think that there's going to be worries about perfusion or cardiac output? And then finally, as people are preparing, like, are there special medicines? Is there special equipment? Or are there special people with special skills that we really need to have either present in the delivery room or readily available?
That outline is going to be so helpful because it's great to have that distinction prior to going into the delivery room. So everybody is on the same page. So that is a great addition to NRP. And it's probably going to, make people realize, we're not abandoning NRP just because this patient has a cardiac anomaly, but, we're just tailoring it to that baby's physiology. So, and it grounds everybody prior to that delivery.
100%, 100,000,000%. Like, one thing we really emphasize is that NRP is still the way to go. And most babies, even with prenatally diagnosed congenital heart disease, usually you still just start with plain old gold standard NRP. So, part of these modules is to really teach the situations that can lead to critical decompensation in the delivery room. But part of our goal is really to empower people. Like, when do we think this baby should be fine and that we don't need to be afraid? Because even the names of congenital heart disease diagnoses can be stressful and freak people out. So, right, we want to both empower people to be prepared and respond when the baby is likely to be in trouble after separating from the placenta. But we also want to empower people that most of the time it's going to be fine and that we don't have to be scared all the time.
I like that focus on preparation and empowerment because I think everybody could use a little bit of that before going into that scenario. So, thank you. Thank you for that.
Yeah.
One of the big questions we're going to get is who should take this course? The people who are, say, at a level 1 or level 2 facility, and they're the ones that are maybe the most scared to get that undiagnosed cardiac baby coming through. And the ones that are at the tertiary care, quaternary care facilities that have cardiology right there are maybe the ones that would fine tune this course. So I would say both populations can certainly use the course. A couple of things I wanted to mention about it. It is a fantastic course. Once you purchase it for a meager $25, can you believe it's $25? It's $25 to purchase this. You own the whole course, which is composed of all the modules. Those modules will live on your learning platform, and you can access them for the whole time that you are certified for that. Now, you are not going to receive an e-card for this, but you will receive a completion certificate. And as long as that completion certificate is good, you can access those courses. So you say, oh my goodness, they said there's an HLHS that just walked in the door. What do I do with a hypoplastic left heart syndrome? And you can actually go to that and get.
What is HLHS?
What is HLHS? What are they talking about? And you can actually go to those modules and you can open that one and get some just-in-time training.
I really appreciate that. And I might even just add to the who should take this. It is designed for any NRP advanced provider. So that is not an advanced practice nurse. That's just an advanced NRP provider. So anyone who has gone through historically the chapters 1 through 11, you have access to purchase these cardiac modules. We are really excited to make this information available to bedside nurses, to respiratory therapists, to advanced practice nurses, to physicians in training. It's so helpful in a resuscitation to have everybody have that shared knowledge to really be able to best step up and work together as a team. So although, right, you might think, well, we don't deliver cardiac babies at our facility, but just as Chris is mentioning, those moms can walk in anywhere and or be not diagnosed prenatally. So we are really excited to have this available to bedside nurses and respiratory therapists on up through the provider list. But we're hoping that it's such a great resource over time, because I will tell you, it is a lot of information. If you sit down and try to go through all these modules at once, one, you're going to need a lunch break. But it's just a lot to try to keep straight, all the different flow patterns and different physiologies. So it is, as Chris is saying, it's available to you to go back, and you can go through the table of contents for each module and really poke at each point in the module that is what you're really looking for. So you don't even have to go through the whole module again. You really pick out the slides and the pieces of information that is most relevant to what your clinical question is right then.
Yeah, that's a great resource because you don't always see the same heart lesion every time. So it might be a few months before you see something. So great opportunity to brush up before you go into that DR. So again, empowerment, and it really sets everybody up for success.
And I'm glad you mentioned, Beth, about all the different people who might really benefit from taking this. So every one of those, physicians, PAs, nurse practitioners, or respiratory therapists, they can get CEs for this as well. So if you have the opportunity or the need to get some CEs, consider this, because you get 3 CEs from any one of a whole bunch of sources.
So we've talked about our cardiac infants, but another situation where NRP extends beyond the delivery room is in the NICU, or if you're unlucky and you have a baby in radiology and they require resuscitation, you have created a course, a module to also help with that. So what considerations should teams keep in mind in those settings?
Yeah, it's a great question, Jill. So the new module is composed of 3 basic parts. The first one is a chapter in the textbook. The second is an online module that, similar to the cardiac module, will be available online using a adaptive learning format. And that module contains 4 different parts. One is respiratory compromise. The other one is cardiovascular compromise. And then cardiopulmonary arrest and post-arrest care. And then the final one is about improving team performance. So talking about how humans perform within the NICU and how that's a little bit different than the delivery room. And then we are also working on a hands-on course, which will be a voluntary course. In addition to the delivery room focused NRP course, this would be a specific course, procedural focused and hands-on simulation, but with scenarios that are directly related to the cases that we'd see in the NICU. So the way that this addresses the unique population in the NICU is that it talks about the reasons why babies arrest in the NICU, knowing that the majority of those babies are already on, respiratory support with the ventilator or CPAP, unlike the delivery room. It does talk about arrhythmias, which can be encountered, both in the delivery room, as they discuss in the cardiac module, but also in the NICU. So making sure people are comfortable with identifying arrhythmias and actually providing, therapy, including electrical shocks through defibrillation or cardioversion, which is rare in the NICU, but it's an important thing, especially, when it occurs, people need to be at least familiar with those rhythms. And then it discusses post-arrest care and talking about, how that looks in the NICU and how that's a little bit different from the delivery room. And then the team performance, which we're really excited about, kind of outlines, what are the intricacies of working with sometimes a multidisciplinary team in the NICU, where you may have anesthesiologists that come to your code, or other, team members with skills that you may not see in the delivery room, and how you work through those human factors, those ergodynamics, and talks a little bit about documentation too.
That's such a good addition because, like you said, the team dynamics, the equipment, even the environment is so different in the NICU than it is in the delivery room. So it seems like this course really meets us where the providers are and not just our traditional resuscitation. So in the NICU specifically, focusing on that, what are some of the unique challenges or priorities when trying to resuscitate these critically ill infants?
It's a great question. I think, when people think about, resuscitation algorithms, they talk about NRP or PALS. And one of the major concerns around using PALS in the NICU is that the PALS algorithm currently talks about compressions, airway breathing, a CAB approach. And that's a concern for a lot of the folks who take care of newborns, because we know, like in the delivery room specifically, like an airway breathing circulation approach may be the best way to go. So we highlight the importance of effective ventilation in the new module, with the same, basic emphasis as in the delivery room, right? You're in most neonatal codes, the reason why they are arresting and the reason why they're bradycardic is because of impaired ventilation and oxygenation. So addressing that as a primary focus in the vast majority of codes is one thing that we really highlight.
I think everybody is very appreciative of that, because in a code situation in the NICU, it seems to be really chaotic. And like you said, there could be multidisciplinary team members in there that we're not used to having. So I think that this will set a really strong groundwork and foundation so we can try to eliminate some of that chaos and approach it more systematically like we do in the DR.
Yeah, and there are units that train people both in NRP and PALS to try to cover that gap that's kind of in the current situation. So potentially in the future, right, as we continue to improve this module, there may be the opportunity to just have, the NICU teams trained with the NRP and the NICU, or the resuscitation of the NICU module from NRP, to avoid the need to sort of be double trained in two different courses.
So Taylor, I understand we just found out that the resuscitation in the NICU will be available in November. So how do you anticipate that what will it look like when it rolls out? Will they be able to access it on their learning platform, and do you know what the cost is going to be? And what about the in-person hands-on portion?
Yeah, we are working rapidly to try to finalize the online module. It took a lot of work, and appreciate all the teamwork from the American Academy and the Action Committee to try to work on to finalize that. So that should hopefully be available in the next few months. I don't know the price point.
It sounds like the online course will be also available for $25 for people to do.
But that should be available the same way that people can access the cardiac module now. It'll be just an option to select that, to purchase it, and then you'd have full access to the module. The time frame for the module, right now, people who have already done the beta test suggest that it's probably, if you're going to do it front to back, probably somewhere around 5 to 6 hours, maybe. It's similar to the cardiac module. You really want to take a break and maybe not do it all in one day. So you can do, again, there's several different modules. So you can do the respiratory one, and then cardiac arrest one, and the post-arrest care. So you can kind of break those up that way. Yeah, and then the hands-on course, what we would envision is somewhere between a 3 to 4 hour course that what we had templated out was it would start with procedural skill stations. So building on the idea that people already know all the skills that they would learn in an NRP course. So extending on to skills like thoracentesis, pericardiocentesis, cardioversion, and defibrillation to make sure people are comfortable with using the defibrillator machines and how to identify rhythms. And then the last one is intraosseous line placement. So they talk about that in NRP, but in the NICU, it may be more common, especially for babies who have lost access or don't have access at the time of resuscitation. Then after that, we do some simulation-based learning. So several scenarios that we've already built out include a baby with acute cardiorespiratory compromise, babies with arrhythmias that need either defibrillation or cardioversion. We've got a shock case where you need to place an IO line, and then a baby with a cardiac tamponade that you need to perform pericardiocentesis. So that's the first 5 cases, and then obviously there's a million other cases we could develop over time if we wanted to. So, but try to align the cases with the procedures that we're teaching, so that you get a chance to learn about the procedures, practice those in isolation, and then incorporate those into what may be a relatively high stress simulation.
That's great. Again, just with cardiac, just having that preparation and, the knowledge prior to going into something like that. Yes, we can't predict that's going to happen, but to know that we've practiced it, we have those modules that we can reference again, it's very empowering for nurses, because the nurses are the constant all the time at the bedside. So it's really important that we have the opportunity to improve those skills, practice those skills, and then be able to apply them when the scenario happens in real life. So we have resuscitated our baby in the NICU. Does NRP continue to talk about post-resuscitation care of those babies? Because, oftentimes in the DR, we bring the baby to the NICU after resuscitation, and then it goes to standard NICU care. But what about post-resuscitation care for a baby that's in the NICU? How would we address that?
That's a great question and kind of complex, and one that actually doesn't have a ton of data to support the recommendation. So it's a little bit challenging. What we looked at was, the idea of, what's the basic, rational way to manage a baby after an arrest in the NICU. Some of the considerations are around, temperature management. As you know, like out of the delivery room, one option is to do therapeutic hypothermia for babies who meet criteria. That data is not present in the NICU for babies who have an arrest in the NICU, similar to pediatric patients and adults who arrest in the ICU. So what we recommend in the module is what we call targeted temperature management. So basically just keep the temperatures within a normal range. But paying attention to temperatures, because it's really important that patients don't get hot after an arrest. I think there's strong evidence to support that. The other things, like in standard ICU care terms, right? If it's low, make it high. If it's higher, make it lower. So if you're hypotensive, you want to keep the blood pressures up to make sure they're normal. If the blood glucose is low, you want to, support that to make sure it's normal. And sort of keep everything within a normal range for a period of time after the resuscitation. But then, paying a specific attention to those things, knowing that patient just underwent a significant event and they're in a very vulnerable period after that arrest.
So let's zoom out even further. What offerings are there for people even in the field? So prior to getting into a NICU environment.
It's a good question, Jill. And a lot of attention lately has been focused on maternal care deserts. And along with the maternal care deserts, neonatal care deserts are also very real in the community. And what we have is a group of people in the community that work with babies on a fairly consistent basis. And babies are maybe born in their rigs. They may be born in the field in living rooms. And we have EMTs and paramedics and other ambulance crew that respond to these emergencies. These folks have been asking for this additional patient population because they can follow the neonatal algorithm, but it stops when the baby is breathing and they are still not in a hospital. So the Neonatal Education for Prehospital Professionals is being developed for this additional population to address the neonatal care deserts. The AAP already has an existing program, which is Pediatric Education for Prehospital Professionals. This is going to be a companion course that is specifically geared for babies who are born in the field and need to make it back to the hospital with additional things that they need to look at beyond the algorithm. That is keeping the baby warm. How do you keep a baby warm in the back of an ambulance? How do you transport a baby in the back of an ambulance? How do you get IV access if you don't have the equipment to put something in the vein? How do you establish an airway that will be secure over bumpy roads when you aren't used to intubating? And how do you keep the baby's glucose up until they get to the hospital? All of these things are addressed in the Neonatal Education for Prehospital Professionals called NEPP, and this is going to be available to community members in early 2026.
I think it's so validating to hear that these maternity care deserts and neonatal deserts are being acknowledged and, we're providing some education and support for people in those areas. So thank you for including that in the program. For listeners, how are they going to be able to access this material in the 9th edition?
Well, Jill, just like Taylor already said, they are going to be already some chapters in the NRP 9th edition text, the ebook and the text. And so chapter 15 will be NRP cardiac. Chapter 16, also a new chapter, will be NRP in the NICU. Learners need to know they are not going to be tested on those two chapters. Those are meant to be additional supplementary educational material. Gary Weiner, one of the editors of the text, likes to call them appetizers. They're appetizers to get you ready to whet your appetite to get into the courses more deeply. So the courses are the NRP cardiac course and then the NRP in the NICU course.
So these courses are new. Can you give us a little bit of a sneak peek on how these hands-on modules look for people that are excited to take it?
Well, I got to be a lucky first tryer that was able to pilot this hands-on program for NRP in the NICU. And just as Taylor described, that there was some practice of procedures. So for those who haven't had the need to or aren't certified in PALS, it goes over a lot of the procedures that are PALS specific that might be very relevant to something that happens in the NICU. So we were trained how to use the defibrillator. We were trained how to place interosseous lines. So just as he described, we each had an opportunity to practice with simulation equipment to do those procedures. And then within that group, we had a group of 6 at our table, and we worked together in a multidisciplinary fashion. We had nurses, we had respiratory therapists, there was myself as a physician. We worked together to practice how we would respond to an emergency that is the kind of emergency that would happen in the NICU. So it was a great opportunity to work together and to practice resuscitating a scenario that is much more likely to happen in the NICU.
Yeah, I had a chance. I was maybe one of the early adopters of the cardiac module online. I downloaded it, I think the first day I saw an email announcement, and that, it's amazing. As someone who works in a pretty high intensity level 4 NICU and takes care of babies with cardiac disease, I definitely learned a lot. It's not an easy module. It does, take some time to kind of go through it in detail. There are, though, some great animations that have been built, and I applaud the team for all the work that's going behind there to kind of show how blood flows to the heart with these complex anomalies, how rhythm disturbances can result in, EKG changes and how to manage those. So it's definitely a huge benefit, especially for those of us who attend deliveries with babies who have known congenital heart disease. So you can kind of plan ahead and be ready for those.
And from the nursing point of view, I would say for the cardiac modules, don't do these on your lunch break. Don't try and multitask when you do these modules. They're deep. They take a deep dive, and they're thinkers, and they're just so good for review and for looking at everything from what the cardiac vessels are perfusing down to all the nuts and bolts of each one of these conditions. The average nurse, I believe, that pulls these up will not be able to just go through them and fly through them. They will make you think.
That's great. And as Beth Ann said, it's also going to empower you. And it seems like the NRP steering committee put a lot of thought into every aspect of this course. And, having videos is so very helpful for visual learners. And as Taylor mentioned, the animations of the blood of the heart is also very helpful for learning all of those really complex congenital heart defects. This has been a very insightful conversation, and I thank you for all of your expertise and sharing the exciting things to come for NRP 9th edition. And it's clear that, NRP is evolving so much. It's just beyond the resuscitation in the DR, but it's providing support and empowerment to everybody that provides care to these babies. So thank you so much for joining us today. A special thank you to the American Academy of Pediatrics for sponsoring today's episode. Their commitment to advancing neonatal education and clinical excellence makes conversations like this possible, and we are so grateful for their continued support. Make sure you never miss an episode of NANcast by subscribing now. This podcast is made possible by listeners like you. Thanks for your support and letting us into your ears. Have a great day.